Hello, everyone. This is Care Work, Historical Perspectives, and this is the 13th lecture for the California Labor class. And as you've already seen from last week's readings on transnational motherhood, as well as this week's reading on care work, is that it's a very kind of complicated issue. What we're looking at here is essentially the type of work that's done in homes. So, for example, we're talking about nannies or housekeepers, domesticas, right, or another word for it. We're also talking about home health care workers, people who particularly help those who are sick or disabled or the elderly, particularly as they suffer through different types of chronic illnesses. So this is all work that's done within the domain of the home, which oftentimes makes it very difficult to regulate. But before we go deeper into the discussion of care work and organizing, I think it's important to give a little bit more background, particularly as it relates to gender, because there's a long history and set of literatures associated with care work. When you look at feminist theory, or you look at gender and sociology, one of the sort of central components is called the gendered division of labor. Now, traditionally, this sort of differentiation or this theory really sort of advocated that there were two spheres. There was the public sphere, which included any work done outside the home, generally for pay. And then you had the private sphere, which included any work done inside the home. Traditionally, any care and reproductive work was considered part of the private sphere. Now, this idea of the public sphere was very gendered in that if you've ever watched something like The Brady Bunch or Leave It to Beaver or any of the sort of old shows that try to look back on the 1950s sort of family, the idea was that the men were the ones who worked in the public sphere, who left home in the morning, and brought home the bacon, so to say, who brought home the paycheck, while women stayed at home in the private sphere, taking care of home, children, and being the bearers of culture. Now, Stephanie Coontz in her work, her scholarly work, showed that that this traditional family notion wasn't always in place. She wrote a book called The Way We Never Were, which highlights the fact that this gender division of labor was very artificially constructed. What we begin to look at in terms of this gender division of labor is that we try to create a spatial frame for male and female work. In other words, when we talk about a spatial frame, that we try to designate particular areas, places, geographic regions that are therefore considered female or male, even within the house. So taking a look at this house, the idea is, and I'm sure you've seen or heard this before, the idea that the men's space, or where men took care of things, would be in the garage, or they would sweep out the front of the house, or they would take care of the lawn, right? So traditionally, this was considered this was considered male space. And then others said, well, and then even within the house, there was female spaces. You took care of the kitchen, the living room, everything else that wasn't really the garage or the lawn, right? That you did all the cooking and you took care of the children's room. And so they really tried to create the spatial frame for how we understood work in the home. I think, just so you know, from the perspective I come from, in terms of sociology and my training, gender refers to a society's notions of masculinity and femininity. It's socially constructed meanings associated with male or female, and how individuals construct their gender identity within these constraints. It determines proper behaviors and placement in the stratification system, and individuals are expected to act appropriately for their sex category. So when we talk about sex, it's male or female. The idea is that with a male or female designation, that this would be sort of a biological term assigned to you when you're born. That when you're born, the doctor says, "Congratulations, you have a baby girl or a baby boy," based on the genitalia. Gender, on the other hand, is a much broader term that really looks at the social meanings that we connect to being male or female. Now, you see this every day. All you have to do is walk into a toy store, Toys R Us, for example. And we see that gender is constructed in a very specific way. Most of us see it in terms of colors. Pink is for girls, blue is for boys. If you walk through the store, you'll see all of the little girls' stuff, for example, is coded as pink. What's really interesting is if, next time you go to a Toys R Us, you would probably also notice that there are different types of toys. So, for example, the other day when I was buying my 5-year-old goddaughter her birthday gift, as I'm walking down the aisles looking for gifts, of course, all the boys' toys are, kind of more rough and tumble. This idea of construction workers, the Tonka toys, right, with the construction worker dump trucks and stuff, and of course you had superheroes, and you would never call them dolls. You would call them action figures. And then as you move into the little girls section, everything's coated in pink. You had princesses, you had dresses, you had wands, you had tea parties and teacups, and all sorts of dress up and makeup things, how to make jewelry. But even beyond that, this just the idea that you wouldn't necessarily have sort of these sort of action figure type of things that you see in the boys section, right? And you see this in Target, you see this in Toys R Us, wherever you go. You can just even browse the internet. Now, the meanings that we attach, that girls are supposed to play with dolls, boys are supposed to be, play with action figures and be more active, that is a gendered construction. These are meanings and behaviors that we attach to being a boy or a girl. I've also had numerous students, when we talk about gender, I ask them, what are some things that your parents say, or your parents or your grandparents have said, maybe to your little brothers or little sisters, right? Many of the boys have reported saying, well, boys shouldn't cry, or little girls should be proper and wear dresses. Although that's becoming a little less common now, right? Little girls should be seen, not heard. Even if you ask your grandparents what was expected of them, you would hear these types of stories. So here, again, it is about understanding how we associate meanings to a particular category. Now, when we're talking about notions of care work, I think it's important to understand this idea or this theory of social reproduction. This is a term used by feminist scholars to refer to the array of activities and relationships involved in maintaining people both on a daily basis and intergenerationally. So here, the idea was that women were supposedly charged with the social or focusing on social reproduction. And here we see this play out in numerous ways, that women were supposed to be the ones who enforce particular cultural norms, everything from types of religion or how religion is practiced, behaviors, right? How you were supposed to act with your elders, right? These are the types of activities and relationships that were practiced both daily and intergenerationally. The idea is that your mom is supposed to be the culture bearer, the one who passes down all the different belief systems. And then there's this other idea of reproductive labor. This includes activities such as purchasing household goods, preparing and serving food, laundering and repairing clothing, maintaining furnishings and appliances, socializing children, providing care and emotional support for adults, maintaining kin and community ties. The idea here is, for feminist scholars, was that this reproductive work was in fact work. It wasn't just something you did because you were a woman or you were a wife, that this was actually a form of work. And I think that this is one of those interesting things. Even today, when someone says that they are a stay-at-home mom, most people will say they don't work. But if you think about what they do on a day-to-day basis, which includes a lot of the things on this list, I think one would argue that in fact they do work, but it's uncompensated. So there is some key sociological arguments that I would like to point out, and here I'm not necessarily even doing justice to what is such a huge body of literature on care work, but I thought it was really important to present this to you as a way of framing how we think about work. We do know that reproductive labor is performed disproportionately by women and is essential to the industrial economy. In other words, we do know that when women do this work, even when they're stay-at-home moms, that it does in fact help economically. Whether that is you're not paying for childcare, that you're not paying for nannies and housekeepers, that's all part of the economy. But beyond that, it is that they are active members and participants in the economics of their own household. We also know that reproductive labor remains invisible. Again, as we say, people, when you have a stay-at-home mom or even a stay-at-home dad, they're like, oh, they don't work. Particularly when it's a father who chooses to stay at home, it really goes against a number of different social mores and values. That's when these things become visible. Is it work if a male stays home? The sexual division of reproductive labor interacts with and reinforces gender inequality in the workforce. In other words, what we do know is because historically, what sociological studies have shown is that because women may be the ones who stay home or choose to stay home, it has also suppressed wages. Men both benefit in direct and indirect ways. Here we understand that even in a situation when you're looking at a household with a wife and a wife and a husband, and I'm being very heteronormative here, that what we do understand is that men wouldn't be able to work the hours that they do if they had a stay-at-home wife. We also know they benefit from the sort of the ideas that are out there that women, if they were to get pregnant and leave the workforce, it becomes a rationale, as I'll talk about later, for higher wages. They benefit directly by contributing less labor in the home while enjoying services women provide as wives and mothers, and indirectly that allows concentration of efforts in paid employment and attain primacy in that area. In other words, what we do know is that men disproportionately get promoted at higher rates. We also know that right now, as of today, women earn, all else being equal, same education, being in the same job, same amount of experience, that women make 70 cents to the dollar for men. There are numerous critiques of this model. It assumes that all women stayed home. It failed to account for the diversity of experiences and histories related to reproductive labor. It also failed to look at the complex interaction of race and gender oppression. So when you look at the history of this model that was put forth, particularly by early feminist scholars, what we do know, and kind of going back to Evelyn Nakano-Glen's integrated framework, we do know that disproportionately those who were stay-at-home moms were white. What we also know is that when you take into account race, Latinos, Asian Americans, and African Americans disproportionately worked and were dual income households. So this model has a lot of assumptions built into it as well. Women of color and immigrants have traditionally done, quote unquote, the dirty work, according to Palmer. The dirty work meaning those types of jobs that others do not want to do, jobs that often remain invisible, cleaning the house, nannies, housekeepers, etc. According to Palmer in 1990, domesticity defined as creating a warm, clean, and attractive home for husband and children often required hard physical labor and contending with dirt. The virtuous woman, however, was defined in terms of spirituality, refinement, and the denial of the physical body. What Palmer basically said is that there are all of these different stereotypes about what a proper woman was. And that this stereotype of the proper woman was really that you wouldn't get your hands dirty. That you would not overexert yourself, right? And that we also know at different historic periods, women would be expected not to have tans, for example, or to get too much sun, that they were supposed to be fair complected as a way of being considered demure and attractive. And we also know that historically who did, quote unquote, the dirty work was varied. In the 1800s, it was done by slaves. In the Northeast, it was later done by the Irish and German immigrant women. In the Southwest, by Mexicans. In California and Hawaii, it was by the Asians. And in the South, by African Americans. So even according to geography, we understand who did, quote unquote, this dirty work or domestic work was very geographically different. So I think one of the things that I think it's really important to note is that there has been this sort of transition in care work, right? And part of this is also about women becoming educated. And that when you look at more contemporary standing of women still have not gained equality in the workplace. We can look at all the different statistics, despite the fact that they should be seeing greater gains. So for example, and I apologize for the 2003 data, this is really out of date, but as you'll see at the note at the very bottom, I in fact tried to update this lecture numerous times over the last 15 days, but the government shutdown meant that I could not update this slide because part of the government shutdown meant that I didn't have access to the National Center for Education Statistics. So not much has necessarily changed, so we're using 2003 data. But what we see here is that in terms of enrollment, undergraduate enrollment in degree-granting institutions by gender from 1980 to 2001, women have outnumbered men. The bold solid black line are females. They disproportionately make up those in the college classroom. This is something you probably see every day at Cal State Dominguez Hills. And then when you look at the percentage of 25 to 29-year-olds with a bachelor's degree or higher by gender, again, you see right around 1991 by that black dotted line that females, by around 1991, females started outdistancing men in terms of receiving their bachelor's degree. So the argument here is that the more educated that women are getting, the more degrees that they're achieving, even by demographic numbers, should therefore be impacting the labor force, and should therefore even have greater access to pay equity, given that they're out in the work world in much greater numbers than men. But here's also what we know, and this is a little bit more recent data, 2006, median income levels by education for men and women. This was taken from the U.S. Census. And I think one of the side notes I want to make here is that when we look at data, it is really important that we look at the sources that we're getting our data from. It is what you do find, particularly if you're watching the news and these different TV journalism, is that they often don't use the most official levels of data. And I think it's really important that you use national level aggregate data that gives you big pictures and that is verifiable. And the U.S. Census is one of the most important data access points for all of us. Now, what I really want you to look at in terms of looking at this graph, or looking at this, graph, I guess it's not a graph, looking at this chart, is looking at what is the median income levels, right, for women and men. And in particular, I want to point to what is probably most pertinent to you, bachelor's degree or higher. So I want you to look at this number right here. What you begin to see, at least in 2006, and it really hasn't inched up all that much since 2006, is that women tend to make about, on average, about $20,000 less. There are numerous different theories for why this is happening. It could be the type of profession that women and men are entering. We do know, studies have also shown that women disproportionately do not go into the sciences and technology, which have higher wages. But we do see that women are going in higher numbers into business. And yet at the same time, when you control for degree, when you control for industry, when you control for age and experience, we still see women making 70 cents to the dollar for men. Now, it seems that the argument here is that over time we should be seeing greater equality, right? That we should have seen a transformation of the labor force, given that these equality rules have been in place for over 50 years. And yet this is still happening in terms of wage inequity. So there are numerous rationales for income inequality. When, when bosses were surveyed for the rationale for why they were paying women less than men, they argued that, well, women were more likely to take time away from the workforce if you get pregnant. Now, even when asked, and even when there were follow-up questions regarding, well, what if this individual doesn't plan on getting pregnant? Or what if they don't get pregnant for another 10 years? Why should it matter? This was still a rationale. Well, they may still potentially take time away from the workforce. And then there was also the actual time away from the workforce. Well, if you were gone for 4 months or 5 months, this was used as a rationale to boost men's income over women. There's also the rationale for income equality is the double duty, working and motherhood, that you get taxed because you may have to leave work early to take care of kids at home or kids after school, or that women were expected to take care of the kids if they got sick and had to leave school. We know that in contemporary configurations, it doesn't necessarily have to be the women, right? So these are some of the rationales put forward by bosses. And finally, it was the consequence on the ability to focus on outcomes that lead to promotion. In other words, they argued that women were less likely to focus on doing what they needed to do to get promoted in their job. Now, true or not true, these are the perceptions that lead to inequality, right? So here's what is really important. It is important to note that this is how people construct women in the workforce. These are the meanings that they attach to being a woman worker. It does not mean that, in fact, that this is factually true. And so I think those are important distinctions to understand the rationales that are based on quote unquote common, what we call common sense ideology. It's just common sense that women would behave this way. Common sense ideology is another way in which we talk about hegemony. Um, these common sense ideologies don't necessarily mean factual truths. Now, I think what's also important to note, particularly as we've looked at this gender division of labor, that as we've entered, as I've talked about in the previous lecture about global cities, there are numerous contemporary configurations that you need to think about. We have in the current moment when you think about care work, and again I'm referring to everything that we've talked about before: janitorial work, maids, nannies, housekeepers, home care workers. It's a largely immigrant working population. It's also predominantly women. And what you find when you look and investigate the lives of these women, and in some cases men, they have transnational families where these women have come to the United States in order to work and send money home to their families. This work is still considered largely invisible. It is also unregulated, meaning that the U.S. government doesn't necessarily regulate for normative working conditions that you look at, that you see in other full-time jobs. Things such as health care. Are you taking out Social Security? Are you paying a living, not even a living wage, are you paying a minimum wage? Are you following labor laws? This whole entire industry is largely unregulated. And yet at the same time it's considered a necessity for working families, but it goes often unacknowledged. So what we do know is that for so many families, in order for them to be able to work, if they have a sick loved one or they have children, in order for them to be able to go to work, they need the help in the household. I think when we think about care work in the global city, the two-income family challenges the traditional formulation of care work. In other words, the breadwinning father and the stay-at-home mother. We know the majority of you probably have two parents who've worked in the labor force, right? Or for me, for a while it was two parents working in the labor force, and after the divorce it was just my mom, right? So what we do know is that there's so many different family configurations now that challenge that traditional formulation of care work and who's in charge of that care work. And yet, despite the fact that we now have more immigrants and home care workers who are doing this care work, there are still the same challenges remain. We have to ask ourselves, how do you quantify the worth of care work? And I think this is an important question to think about. Nannies, housekeepers, and home health care workers are charged with caring for the people and things we value the most. But these individuals are paid the least. Think about it. For most families, their children are their most important people in their lives, and they're entrusting their lives and safety of their kids to these individuals, but often don't pay living wages. Work in the home is often devalued and hard to regulate. And when we talk about devalued, it comes up in the Givada article, where they talk about that it is not given high status. It is not a high status job. And furthermore, workers are isolated and subject to very different treatment by each employer. And these are things I want you to keep in mind, because the next set of lectures going into next week will be thinking about how do you organize in this kind of context? How do you search for social justice when people are so isolated? So some critical questions that you need to think about and should answer in your journals for this week. What makes care work different than other jobs? What makes it different from working in a bank or being a teacher? What makes it different from the types of jobs you're preparing yourself for? In the readings, what do we learn about workers themselves? How are the experiences of immigrant workers different here in the United States compared to their countries of origin? How do transnational relationships and experiences impact immigrant workers? And finally, how is this work gendered? So think about it. Frame your answers. I think that, and you should also feel free to combine the reading from last week with Pirette Hananu Sotelo.